Dear learners, welcome to another engaging module in the Swayam MOOC course on Geography of Health and Wellbeing. Today we will delve into the measures of health. The purpose of this module is to assist you in selecting, managing, interpreting, and utilizing health indicators effectively. By the end of this module, you will have the skills to understand the various types of health indicators, learn how to select appropriate health indicators based on conceptual and practical considerations, interpret the data to draw meaningful conclusions about health and well-being, gain personal skills in calculating and interpreting these health indicators, apply your understanding to make an informed decision and improve health outcomes. By the end of this session, you will be equipped with the knowledge and tools to effectively analyze and apply health indicators in real-world contexts. So let's get started. While measures and indicators are terms often used interchangeably in health and in other fields, they have distinct meanings. We have to try to understand this difference. What is a measure? Measure are descriptions of variables or phenomena. They are raw data or values obtained through observation, survey, experiment. Measures are specific values or numbers. They provide direct data points. Examples include height in centimeters, weight in kilograms, blood pressure readings, etc. Measures and measurement. While the verb measure refers to the procedure of applying a reference scale to a variable or set of variables, the noun measurement refers to the extent, dimension, quantity, etc. of an attribute. Measuring health variables involves two levels of measurements, which can be generated in the following ways. 1. By direct individual observation. Second, by observation of the population groups or locations based on observations. What is an indicator? Indicators are derived from measures and are used to summarize and communicate complex information about a system or condition. They often involve calculations or combinations of multiple measures to give a clearer picture of a particular aspect. Data. Data is the most basic input, and this data is managed to generate an indicator. Hence, indicator is a measurement that reflects a given situation. The analysis of indicator generates information. Information once interpreted produces knowledge, and knowledge requires dissemination by appropriate and efficient communication processes to influence health-related decision-making and produce an action. Measuring and monitoring health indicators are important to provide a foundation for measuring inequalities and guide evidence-based decision-making. Measures and indicators are quite different from each other, even though used interchangeably at times. A measure measures something, and an indicator indicates something. While measures use direct data points or values, an indicator is the summarized information derived from measures. In that sense, measures are raw and unprocessed data, while indicator is processed and interpretable data. Indicators can be of two types: absolute indicator and relative indicator. Absolute indicator. A count gives the number of occurrences of the event being studied within a specific time and specified place. It describes the magnitude of the problem and is referred to as absolute frequency. For example, number of people who are diagnosed with asthma. This is useful, but this cannot reveal the gender-wise, age-wise or cause-wise distribution that is useful for policy making. Hence, we need to understand the relative measures. Relative data and indicator. Let's use data related to a health indicator like smoking prevalence to explain the difference between ratio, proportion, rate and odds. These are the different kinds of relative indicators. Ratio. A ratio is a comparison of two quantities. It is expressed as A to B or A divided by B. For example, suppose in a population of 10,000 people, 3,000 are smokers and 7,000 are non-smokers. Then the ratio of smokers to non-smokers is 3,000 divided by 7,000, which is 3 by 7. Proportion. A proportion is a type of ratio that compares a part to the whole. It is expressed as a fraction, decimal or percentage. For instance, using the same population of 10,000 people with 3,000 smokers, the proportion of smokers is 3,000 divided by 10,000, which is 0.3 or 30%. Next, rate. A rate is a ratio that compares two quantities of different units. It often involves time. For instance, if we want to look at the incidence rate of new smokers in a year within the same population, assume that there were 200 new smokers in a year. The incidence rate of 10,000 people per year will be 0.02 new smokers per person per year. Odds. Odds compare the likelihood of an event occurring to it not occurring. It is the ratio of the number of events to the number of non-events. For example, the odds of being a smoker are 3,000 smokers by 7,000 non-smokers, which is 3 by 7. These metrics are helpful in public health to understand the extent of health issues, the distribution of health events, and to plan interventions effectively. An health indicator is defined as a summary measure that captures the relevant information on attributes and determinants of health status and performance of a health system. It attempts to describe and monitor a population's health characteristics or qualities. Health indicators are metrics used to assess health status of individuals, populations, and communities. There are two types of indicators, positive and negative health indicators. Indicators are positive when they have direct relationship, that is association or correlation with healthiness. The healthier the indicator value, the better is the state of health of people in the population being studied. For instance, life expectancy at birth, vaccination coverage, indicators are considered negative when they have inverse relationship with healthiness. The higher the indicator value, the worse is the state of health of people in the population being studied. For example, infant mortality rates, maternal mortality rates. An indicator is not only used for the purpose of observation, spatial distribution or temporal patterns, but they also provide critical data that helps in making informed decisions in various aspects of healthcare, public health and policy making. There are various uses of these health indicators. Description. Health indicators are used to describe the healthcare needs in a population and disease burden in specific population groups. This is useful to identify gaps such as groups and diseases that require attention. For instance, health trends, that is to identify and analyze trends in health behaviors, outcomes and risks over time. Forecasting or prognosis. Health indicators are used to anticipate results with regard to the state of health, that is forecasting the health of population, or to forecast the health of community or even a group, or to forecast the risk of disease outbreak. For instance, disease tracking, that is to monitor the incidence and prevalence rate of diseases, outbreaks and epidemics. Explanation. Health indicators can facilitate understanding of why some individuals in population are healthy and others are not. To seek answers to such questions, one can explore the factors influencing health, including social factors, political factors and others. System management and quality improvement. Regular monitoring of health indicators can provide feedback to improve decision making. Evaluation. Guide the creation and evaluation of health policies and programs. They investigate the outcome of different health interventions and treatments. Risk assessment. This helps to evaluate the health risk and needs during emergencies and disasters. Response planning, that is to plan and implement effective health responses in a crisis situation. Research. Spatial and temporal information generated by health indicators facilitate research to explain observed trends and discrepancies. To measure gaps. It helps in identifying and addressing health disparities among different population groups. To compare health indicators across different countries and regions and to understand the global health disparities. Desirable attributes of a health indicator. Validity. This is the ability of an indicator to accurately measure what it is intended to measure. Reliability and consistency. It should produce consistent results under consistent conditions. That means it should be reproducible. It should yield similar results when used by different people in different settings. Sensitivity. It should be able to detect changes or differences in health status or condition being measured and respond to small and significant changes in health status. Specificity or precision. It should measure only the health status or condition of interested group or people without being influenced by any other variable. That means it should be exclusive. It should not be affected by unrelated factors. Feasibility and measurability. This refers to the availability of data to measure the indicator. It should not require excessive time and money or expertise to collect, analyze, or interpret the data. It should be easy and practical to use. Acceptability. It should be acceptable to those who use the data and those from whom the data is collected. It should be culturally appropriate and sensitive to the population being measured. That means to have ethical considerations and not reveal any personal details of the individuals or group from which the data is collected. The indicator should be able to provide information that is useful for policy making, health planning, and clinical practices. It is necessary to provide the information and knowledge generated by indicator to be able to provide data in a timely manner to allow prompt action. Comparability. An indicator should be standardized to allow comparisons over time across regions and across populations. It should allow for benchmarking against national or international standards as well. Transparency, clarity, and accessibility. The methods of data collection and analysis should be clear and transparent. Further, the data should be accessible, available, and understandable to the users. Ethical considerations. This refers to ensuring the confidentiality and privacy of individuals whose data is being collected. Data collection should be conducted with informed consent from the participants wherever applicable. Actionability. Indicator must provide information that can be used to inform interventions and health improvements. It should support the decision-making process. Representativeness. It is important that indicator accurately represents the population of interest. It should include all relevant demographic groups, avoiding biases, and most importantly, it should be inclusive in nature. Simplicity. That is the ease of the user. The indicator should be straightforward to understand and use, both in data collection and interpretation. Sustainability. This refers to the qualities needed for the indicator to be able to be usable over a span of time. This depends on local conditions, availability of data, technical capacity, and most importantly, political will. Indicators that are simple in calculation are likely to be more sustainable. For instance, crude death rate, crude birth rate, infant mortality rate. While indicators such as quality of life, disability-free life expectancy are useful but complex in calculation, and therefore they might be unsustainable for a very long period of time. Health indicators could be absolute, it could be counting, or relative, expressed in terms of ratio, proportion, rate, or odds. An indicator may be as simple as absolute numbers of events or a complex calculation expressed in relative measures. The most frequently used measurements are counts, that is absolute measures. Ratios, proportion, rates, and odds are relative measures. In health epidemiology, incidence and prevalence are two metrics used to understand occurrence and spread of diseases within a population. Let's understand what these are and how are they calculated. Incidence rate refers to the number of new cases of a disease that occur in a specified population during a defined time period. Incidence rate is calculated as the number of new cases during a specified period divided by population at risk during the same period multiplied by a multiplier. It is used to express the incidence rate per a standard number of individuals. For instance, suppose a population of 10,000 people, there are 200 new cases of a disease over 1 year. Then the incidence rate will be 200 divided by 10,000 into 1,000. That is 20 new cases per 1,000 population per year. Prevalence rate. This refers to the total number of cases, both new and existing, of a disease in a specified population at a given point in time or over a specified period. It could be a point prevalence rate, that is being specific in time, or period prevalence rate, where it could be using the total time period. Prevalence rate is calculated as number of existing cases, that is new and the pre-existing cases at a specific time divided by the total population of that time and multiplied by a multiplier. So suppose the same population of 10,000 people are there, and in that 500 are existing cases of a disease at specific point in time. The prevalence rate will be 50 cases per 1000 people. The difference between the two rates will be clearer from the table given below. While the incidence rate measures the risk of developing a new disease, the prevalence rate measures the burden of the disease in the population at a given time. Understanding both incidence and prevalence rates is crucial for public health planning and resource allocation. The incidence rate helps in identifying new cases and assessing the risk of disease spread. It is important for determining the effectiveness of preventive measures. The prevalence rate provides insights into the overall impact of the disease on the community, including the need of healthcare services and ongoing treatment. By regularly monitoring both incidence and prevalence rates, public health officials can better understand disease dynamics and implement effective control policies. The kinds of health indicators. Health indicators are metrics used to assess and monitor the health status of individuals, populations, or health systems. They provide essential data for health planning, policy making, and evaluation. There are various types of health indicators categorized based on different aspects of health and healthcare. Some of the following are the main types. Mortality indicators. These include measures that are discussing the deaths in a population. For example, crude death rate, that is the total number of deaths per year per 1000 population. Age specific mortality rate. Mortality rate within specific age group is calculated by age specific mortality rate. Infant mortality rate. This is the number of deaths of infants under 1 year per 1000 live births. If there are 2500 deaths of infants in 1 year among 100,000 live births, the infant mortality rate will be 2500 divided by 100,000 into 1000. That is 25 deaths per 1000 live births. This indicator estimates the risk that infants born alive will die during first year of life. If the infants die within the first 7 days, early neonatal mortality rates can be calculated. For 8 to 28 days, late neonatal mortality rates are calculated. And for 29 days to 11 months, post neonatal mortality rates are calculated. And for a child, it is 12 to 59 months that makes it possible to monitor effectiveness of policies and programs and interventions to prevent infant deaths. Maternal mortality ratio. This indicator indirectly estimates the risk of women dying from pregnancy related deaths. It reflects the access of services and quality of care provided to a woman during the pregnancy and childbirth. Since most of these deaths are preventable with effective policies, maternal mortality rate is an important indicator used to improve health services. The measures of mortality can be disease specific, group specific, cause specific, and social determinant specific. Next, we come to morbidity indicators. These are used to measure the illness or sickness in the population. These indicators measure the incidence and prevalence rate of diseases and conditions within a population. Since we have already discussed incidence and prevalence rate earlier, I'll move forward to the next category. Very important category in this is disability adjusted life years or DALYs. This is a measure of overall disease burden expressed as number of years lost due to ill health, disability or early death. If a population loses 5,000 years of healthy life due to disease and disability in a year, the DALY will be 5,000. Other common morbidity indicators are attack rate, secondary attack rate, case fatality rate, duration of illness and sickness, relative risk, attributable risk and odds ratio. Nutritional status indicators. Nutrition is a dynamic process in which the consumed food is utilized for nourishing the body. So whenever the diet has a deficit of a nutrient or a disease process sets in, the deficiency signs develop. These can be measured by a number of variables depending upon the type of nutrient we are interested in. It could be protein energy malnutrition or vitamin A deficiency, or prevalence of low birth rate is also an important indicator of this category. Body mass index is an important and very much used indicator to understand the body fat from weight and height of the person. Health service indicators. These indicators measure the availability, utilization and quality of health services. These include hospital bed density, that is number of hospital beds divided by total inhabitants multiplied by 1000 in a given year. This will give the number of hospital beds available to population in an emergency. Immunization coverage, that is percentage of the target population that has received specific vaccines. Antenatal care coverage, that is percentage of pregnant women receiving antenatal care. Next we come to behavioral and risk factor indicators. These indicators measure behaviors and factors that influence health outcomes. For example, the prevalence of smoking or average per capita alcohol consumption or percentage of population engaging in regular physical activities, or obesity rate, that is percentage of population with a BMI over 30. Socioeconomic indicators. These indicators measure the social and economic factors influencing health. For example, education levels, that is percentage of population with access to education or literacy rate or enrollment ratio in a school. Income levels, that is median household income, or it could also be understood with the help of expenditure. Poverty rate, percentage of people living below the poverty line. Unemployment rate, that is percentage of labor force that is unemployed. All these indicators help in understanding the health status. Next we come to environmental indicators. These indicators reflects the quality of physical and biological environment. For example, air quality index, that is a measure of air pollution. Percentage of population with access to safe drinking water is a measure of availability of drinking water to people. Sanitation coverage, percentage of population with access to improved sanitation services or toilet facilities. Levels of harmful substances in the environment, that is also very important to understand the exposure to hazardous chemicals that a population may be at risk to. Next, we come to reproductive health indicators. These indicators measure aspects of reproductive health. For example, total fertility rate, that is the average number of children born per woman. Contraceptive prevalence rate, that is percentage of women using contraception. Adolescent birth rate, that is number of births per 1000 women aged between 15 to 19. There are various mental health indicators as well to measure the mental health status of a population. These include prevalence of medical disorders, that is percentage of population with diagnosed medical health condition, suicide rate, access to mental health services, and there are a few indirect measures which includes acts of violence, crime and drug abuse that also reflect on the mental health situation of the population. Health system performance indicators. These indicators measure the efficiency, effectiveness and equity of health systems. For example, health expenditure, that is the total health expenditure as percentage of GDP. The coverage of health services is very important, that is the proportion of people covered under essential health services across the country. Equity in health access. Availability of health is a different matter. A health service may be available but not accessible. It is important to understand the accessibility of these health services among different population groups. Patient satisfaction, that is percentage of patients satisfied with the health services received. These health indicators provide a comprehensive picture of the health status and healthcare needs of a population, helping policy makers, health professionals make informed decisions. There are also some disability indicators that are important to understand health status. When we say a person is unhealthy, it implies that he or she is able to perform her full range of activities. And when they fall ill, some physiological or psychological problem occurs, which in turn limits some of their normal activities. In other words, a person is called disabled and the phenomena is called disability. This is calculated by Daly, which is also discussed earlier. With the advancement of medical knowledge, the death rates have declined, but the disability rates have increased. The rates usually used are bed disability days, work days lost, school days missed within a specific period. These indicators are used for calculating an index called the Sullivan's index, which tells about the expectation of life free of disability. This index is computed by subtracting from the life expectancy the probable duration of bed disability and inability to perform major activities. Sullivan's index is considered as one of the advanced health indicators. Based on the premise or portion that health implies a full range of daily activities, these indicators may be grouped into event type indicators or number of days of restricted activity, bed disability days, work loss days within a specific period, or person type indicators, that is limitation of mobility, limitation of activity, Sullivan's index and expectations of life free of disability. Next we come to the quality of life. With the increased survival rates, the emphasis is now on quality of life and not only the length of life. As is evident, quality of life is difficult to define and measure. Various indicators are being developed by experts to measure this aspect. Physical quality of life index, human poverty index, happiness index. The physical quality of life index, that is PQLI, is a measure designed to assess the quality of life or well-being of countries or regions. It was developed by the sociologist Morris Davis Morris in 1970s as an alternative to purely economic indicators like GDP per capita. The PQLI focuses on physical quality of life rather than economic wealth. The PQLI is calculated on the basis of three basic indicators. Life expectancy at age 1, that means till what age a child is expected to live, that is life expectancy, infant mortality rate and literacy rate. Each of the three indicators is scaled from 0 to 100. A score of 0 represents the worst performance observed globally. A score of 100 represents the best performance observed globally. The PQLI is then calculated by averaging the scaled scores of these three indicators. The interpretation can be done as high PQLI indicates a high quality of life with good health and education outcomes, while a low PQLI indicates lower quality of life with poor health and education outcomes. This provides a broader perspective on well-being compared to purely economic indicators focusing only on the physical quality of life in a population. Health policy indicators. These are important indicators of political commitment as they determine the allocation of adequate resources. For example, proportion of GDP or GNP spent on health services, proportion of GNP spent on health related activities, proportion of total health resources devoted to primary health care, and other fundings by the government. Besides these, there are some indicators such as health for all indicators that assess the progress towards universal health coverage and ensure access to necessary health services without financial hardship. For instance, to access health services, one may understand the proportion of population covered under health insurance, number of healthcare facilities per thousand population, or average distance to the nearest healthcare facility. Similarly, quality of health services may be patient satisfaction rates, healthcare professional to population ratio, hospital bed density. Health outcome indicators can be life expectancy at birth, maternal mortality ratio, and incidence and prevalence of major diseases such as HIV, AIDS, tuberculosis, or malaria. Finally, the preventive care indicators are immunization coverage rates for various vaccines, screening rates for common diseases, and proportion of population practicing safe health behaviors, that is use of mosquito nets, safe health sex practices, etc. All health indicators can be classified into various headings such as risk factors or morbidity status, mortality, health services, and so on. Few of the examples are presented in the table below. Beyond this, the Global Burden of Disease by the World Bank and Harvard University have listed a number of indicators of health like quality adjusted life year, the disability adjusted life year, healthy life expectancies, years of life lost, and disability free life expectancy. These will be discussed in another module on global burden of diseases. To sum up, one can state that an indicator is a key statistical measure selected to describe a situation, track progress and performance, and act as a guide to decision making. An indicator is a measure that is used to demonstrate change in a situation or progress in or results of an activity, project or program. Health indicators support researchers with evidence and therefore can be qualitative or quantitative. And also there could be perception studies depending upon the nature of research. Health indicators must be feasible to collect, valid statistically, reliable and objective. It is necessary that the health indicator can be applied internationally and facilitates comparison. It is also important that indicator is able to track the progress and performance of health indicators with time that would help in decision making and amendments. And finally, there is no single comprehensive indicator of nation's health. Each of the available indicators reflect one or more aspects of health. So dear learners, today we discussed about the differences between measure, measurement and indicator, the kinds of indicators, both absolute and relative. We also attempted to understand the difference between ratio, rate and proportion. We also delved into the nature, qualities and uses of various indicators. Further, we discussed the nature and application of health indicators with details on different types of health indicators used for decision making. The next module will delve into sources of data for health indicators. Till then, wish you good health and well-being. Stay healthy and blessed. Thank you.